it was evident that Kati had many a sleepless night. Her red eyes and her burnt knee told it all. Kati was asked whether she required help. She never understood language. The facial expressions of others made her realize they were concerned about her limp. Kati used hand gestures to indicate that she was having severe knee pain. Her grandchild has seen Kati holding her knee against fire. Don't worry, we will somehow take care of you. They expressed themselves in gestures. Kati smiled for the very first time in weeks. The others smiled back. Meet Kati, the lead person in my story. She lived close to Udawalawe River, Sri Lanka, in a place called Bellambendi Palace. Her family unit consisted of 12 other people, aged 7 years to 65 years. Kati was around 55 years when she died. Kati's knees. These are what were left of Kati's knees. One femoral condyle onto your left side is highly eroded, while the rest of the condyles are well contoured. Kati had right knee osteoarthritis with a deformity. I found these bones at the National Museum of Natural History back in 2017. This specific set of bones and the earth layer that they were found was carbon dated back to 12,750 years before present. 12,750 years before present. So Kati had severe knee osteoarthritis. Human paleontology techniques estimated her age to be around 55 years. What you see on the right side is Kati's femur compared with the femur, a modern day femur of a well-grown adult male. So how did we live during Mesolithic period, the Middle Stone Age, 20,000 to 10,000 years before present? We were hunter-gatherers. There was no such concept called villages. Groups as small as extended family to no more than 100 people lived as bands. I wouldn't call these tribes. We had a few domesticated animals. We had tools. We had bow and arrow discovered 48,000 years ago in Sri Lanka. We had fire and the ability to speak with a limited vocabulary and lots of gestures to express ourselves. There was no evidence of religion, but we might have had rituals. We didn't have burial rituals back then. For a 55-year-old woman to survive with knee disability, she would have had a supportive circle of human beings, even when there was no such concept called marriage or family. They might have fed a non-productive, not so useful elderly female and helped her to survive due to some unknown reason. Kati might have used devices like walking canes or even wooden braces, who knows. Where Kati's remains were found, there were bone remains of 12 other people in the same layer. This might be the first evidence of a family unit in prehistoric Sri Lanka, man, woman and child. The museum researchers, actually these are the original sketches of Dr. P.E.P. Dharaniyagala, the former director of National Museum of Ceylon. He did these sketches back in 1956. He is the person who found Kati and her relatives in Bellambendi Palace. He did the excavation. And you can see Kati's skull as well as another skull right next to it, and the bones of Kati. So the museum researchers wanted to know the reason for sudden death of this group. They have found oyster shells in the surroundings. Mind you, Kati was found close to Ambilipitia. And I proposed an infection like cholera. This group might have had an annual excursion to the sea to collect salt. Without modern day resuscitation methods, the group wouldn't have survived for even 4 days with cholera. But that is a different lecture. Numerous questions remain unanswered. What types of behavior led to survival of groups similar to Kati's? How the elderly and the disabled survived during Stone Age? How coordinating as a group of unknown strangers helped everyone? How this brought in this concept of social security, even when the group members found no use of a disabled person. I find that human beings are unique in two different ways. Ability to synchronize work even without knowing each other. This session is a good example. I do not know people behind the AV unit, but we coordinate, we synchronize work. And number 2, caring for others without expecting anything in return. These two form the very basics of rehabilitation and the concept of a multidisciplinary team. Margaret Mead, an American anthropologist, first she was asked about the first sign of civilization in a culture. They expected Mead to name religious artifacts, pots, sculptures. Mead said no. She said that the first evidence of civilization was a 15,000-year-old fractured femur found in an archaeological site, a healed femur. Someone has helped a fellow human rather than abandoning him to save their own life. She stated that helping someone else through difficulty is where civilization begins. How did we care back then in the prehistoric era? Why did they help Kati? What were the reasons? Who helped her? Children, women, men? Was it a prehistoric multidisciplinary team? One to hunt and provide her food, one to cook meals, one to prepare a wooden walking cane, another to prepare an unknown herbal painkiller paste perhaps? What was the thought process that led to her care? What were the arguments? Who represented patient rights of Kati? A lot of interesting questions remain unanswered. Anthropology is the study of humanity concerned with human behavior, human biology, cultures, societies, linguistics in both the present and past, including past human species. I will concentrate more on sociocultural, biological, and archaeological fields during my speech. And I intend to translate, link, extracts from anthropology into medical humanities. Rehabilitation is helping patients regain or maximize their functions, usually following illness or injury. In 1904, Professor Tate McKenzie, a US professor, taught the fundamentals of rehabilitation, such as exercise, massage therapy, hydrotherapy, and other modalities. Story number 2. The elderly monk had swollen joints. He was a traveling monk. He mentioned that he came from a country called Sina. 10 years I spent walking across India. That was too tiring for me, the traveling monk said. I heard that you have a special method to cure me of my joint pains. I intend to travel back to Sina soon. So please heal me. Of course, we can cure you of all your ailments. The junior monks offered to help. We have a special chamber that does wonders to your painful joints, but it will take at least 2 years for us to heal you. Meanwhile, you could visit our library and read all our scripts. And first, let our specialist monk apply soft clay over your face. Facial skin is sensitive. We do not want you to have facial burns. Thank you so much. Then I will stay with you until the healing rituals are done. The traveling monk replied. Follow me. Let me begin the session. The specialist junior monk took over. The story and rituals behind Janta Gara. Janta, fire, Gara, house, firehouse at Abhayagiri Monastery, 2nd century before Christ. Janta Garas are chambers filled with steam with a shallow warm water pool. These are similar to modern day saunas or steam baths. So what you see on the left side is the largest Jantagara at Abhayagiri. I found about 5 Jantagaras at Abhayagiri, but these are not just confined to the Abhayagiri monastery. It's seen all over Sri Lanka. These are seen all over. These are the shallow ponds where warm water has to be filled. So as you can see on the right side, there's a grinding stone that might have been used to prepare herbal pastes. The first photograph on your left side is the fireplace where warm water was prepared. The second is a water outlet. The third, as you can see, the circular structure, stone basin, might have been used to keep these soft clay balls or herbal pastes. These are still there. So there was a curious ritual explained under the Buddhist scripture Tripitaka, subsection Vinaya Pitaka, subsection Chullavaga Pali, and the Jantagara Vattan chapter. The junior Buddhist monk should clean the firehouse, clear out the ashes, Fill the water containers, apply clay paste on the faces of those who enter the chambers, escort people into and out of the chambers, clean the pond of remaining monk, and close the doors. I just want to highlight two concepts here. Use of balneotherapy, warm water or steam therapy for healing, a form of modern day physiotherapy, and taking care of the sick for patients to regain or maximize their function. Now, other than being famed as an academic institution, was Abhayagiri a rehabilitation center? The Chinese traveling monk Fa Hien in the 5th century AD visited Abhayagiri, the flourishing center for Buddhist studies. The monk lived there for 2 years at Abhayagiri monastery, copying Buddhist texts, and took all copies back to China. But was he occupied only with copying texts? Did Fa Hien undergo Jantagara therapy and rituals at Abhayagiri monastery? Did Fa Hien undergo rehabilitation in Ceylon after a 10-year tiring Indian tour? So how did we care 2000 years before present? Why were these Jantagara rituals carried out? What drove them to carry out a not so religious, a not so meritorious ritual? Who cared for the ill and the disabled? Was it just the monks? What about the architect who designed these buildings, the stone mason, the good supplier for clay and herbal pastes, the attendants, the physician who prescribed the herbs, the multidisciplinary team again? What was the thought process that led to the rituals? They could have avoided this and they could have just concentrated on the Buddhist scripts. What motivated them? A lot of questions remain unanswered again. Then to my third story. She is crippled. We are struggling to carry her, they said. I have heard of a place where they have small carts that can carry the crippled and the blind, the stranger replied. Are these carts similar to bullock carts? They queried. No, these are small carts with several wheels, the stranger laughed. Our Lord had made treatment house exclusively for patients like your mother. They will give herbal remedies to all patients as well. We will somehow escort our mother to the place that you told us. Please tell us the route. They appear to be very grateful. My third story is about hospital complexes mentioned in ancient Sri Lankan scripts. In Chulavamsa, an ancient script translated by Wilhelm Geiger, King Udaya I built a hospital between 901 to 912 AD for the blind and the crippled in Padaviya. There is also an interesting Pali language word used here, Pitta Sapping. Pitta in Pali language is chair, Sapping is moving alone. Pitta Sapping is a moving chair. It might have been a wheelchair. In the ancient Sri Lankan script Mahavansa, there is further evidence of hospitals for the blind and the crippled. King Buddhadasa, King Upatissa, King Dappula made these between 340 to 662 AD. How did we care 1500 years before present? Why hospitals were made exclusively for the blind and the crippled? Was it because these two diseases were categorized as disabling, needing rehabilitation, when there was no such thing called ICD classification? Who cared for the blind and the crippled? Not just the physician. They would have employed nurses, good suppliers, healthcare assistants. They might have had trainees and interns, a cook, an appliance designer, registrars perhaps, a multidisciplinary team again. What was the thought process that led to care? What were the protocols, the admission criteria? What was the incentive? World's earliest known literacy works date back to 2,500 years BC. Modern Homo sapiens originated 200,000 years ago. We might have missed an untold history over a period of 195,000 years. We read ancient literacy works and call these as originating from a civilized society. But weren't those band of people who lived at Beldanbedi Palace civilized? Similar to the tale of Kati and her band of merry men and women, we have missed millions of untold stories of humanity that had happened throughout these 200,000 years. Stories from prehistoric poets musicians, singers, authors, bards, comedians, and artists. The aim of my presentation, the aims are to search and extract bits and pieces of anthropology and history and use these to study how health and illness are entangled with culture, politics, and the social world, and to also provide an insight into questions of human suffering, illness, and diseases by situating them in historical and cultural contexts. We need competent doctors who possess human knowledge outside the scope of clinical skills, competencies, and reasoning abilities. I attempted to search through Google Scholar and YouTube. There are many articles and videos on the definitions of medical humanities, but I only found one article on anthropology and medical humanities, that too originating from a vet clinic. Before I end my presentation, I would like to acknowledge the help given by Mrs. Lakshika Marasinghe, my research assistant, Department of Geology, Department of National Museum, Sri Lanka, Mrs. Sanuja Kasturiarachchi, Director, Department of National Museum, Sri Lanka, Professor Raj Somadeva, a dear colleague of mine, a senior professor and a very good friend at University of Kelaniya. He's an archaeology professor. Professor Arusha Disanayaka, sir, and Madhuwanti for asking me to do this presentation. I think the Sri Lankan medical, the audience is now prepared to listen to unconventional, unorthodox lectures similar to mine. And I would like to also thank my patients who posed for my photographs. All these portraits are of my patients, and also my family for tolerating my nonsense. And I would also like to thank the team of architects, builders, artists, structural engineers, mathematicians, interior designers who constructed the beautiful Abhayagiri monastery. Their names are forgotten, but what they constructed withstood the test of time. These are my references. And now Kati is actually the queen consort of King Dutugamunu. King Dutugamunu has 6 chapters devoted to him out of the 35 chapters in Mahavansa. But Kati and their daughter Anuradha's names are not mentioned in Mahavansa. Kati, aka Ramanibari, was a commoner from a native family. Sinner, the word that I mentioned earlier, was used it's used to used in the Katapat powder, the mirror wall, and it's meant the meaning is China. Sinner Patabeje is Chinese fabric. Most probably it might have been silk. Finally, even after Kati's group perished mysteriously, I am sure that someone, a survivor perhaps, might have passed down the good traits of rehabilitating a disabled person. If I was granted one wish, I would have traveled back in time. I would have observed secretly how Kati was cared for. Humans adapt to survive. Kati's band adapted to survive as well. Thank you very much.